Hey folks, Dr. Maggio here. I want to go over with you how to save time when you're using the PulStar with your patients. Let's think about this for a second. Many of you, before you started using the PulStar, did manual treatments, right? So let's look at this from way back in time before you started using the PulStar. Let's say you adjusted someone's cervical spine manually, Gonstead, diversified, whatnot, and you got an audible release. How often did you go back and readjust and readjust and readjust on a visit? The answer for most of you is, I never did that. I went in, manually adjusted the patient, got an audible release, and I left it alone. Maybe if you tried to adjust them and the vertebrae didn't go, you know how we used to say that? It didn't go. You might try it a different way. You might try it prone and then supine or seated, but probably you're only going to try 2, maybe 3 types of maneuvers on a visit to get the vertebrae moving, because if you don't, what's going to happen? They're going to feel miserable. We all know that. Okay, let's look at the PulStar now. When you do the math behind how much force the PulStar puts into the adjustments, the percussion that it's putting in puts on average 5 times more force than we can do by hand. So why in the world are you going back and readjusting and readjusting and readjusting on each visit? The reason is one and one only. You're searching for a perfect scan. Let me give you some advice. Stop doing that. If you're trying to get a perfect scan every single time you treat a patient, you're doing them a disservice. You're putting too much stress into the muscles and into the joints. You may actually be causing reactive spasm. And if you cause reactive spasm, they're going to walk out your door and they're going to flare right back up again. Going for a perfect scan does not work. So let me give you a simple tip. You scan, you adjust, you rescan. You didn't get the desired result. Here's what you can do. Maybe some trigger point protocols. Maybe some myofascial protocols. Maybe you can do the point protocol. But don't do all of them. Try one. Go back then and rescan and see if it made an improvement. 9 times out of 10 it did. But if you didn't get an improvement, stop beating them up. You're going to cause more inflammation, more reactive spasm, then it's going to take longer to get the patient better. So, chasing the perfect scan, not good for the patient, but also it's not good for you. Because then what happens is you're trying to do too much with a patient on a visit. When you're trying to do too much on a patient with a visit, what's going to occur is you're going to waste time with them. We don't want to have that. Compare this to physical therapy. Let's say someone went into physical therapy with a blown out knee and they're doing rehab after surgery. Do you think they want to get everything done on one visit? No. Stop utilizing that philosophy. Try to get them better. And if you see better, stop. You could always do more on their next visit. Give that a shot, folks. You'll be happy with the results, and you'll get a better result for you and your patients. Have a great day.